Welcome to this short video with the purpose to instruct patients on nurse-led follow-up to be able to examine their own neck to check for recurrences of their thyroid cancer. Such initiatives, e.g. with self-examination for breast cancer, have proven very beneficial in the past in determining if patients' cancer has returned and is in guidance with the new National Stratified Pathway for Thyroid Cancer Follow-up. During your treatment pathway for thyroid cancer, patients will be stratified into low, medium or high risk, and it is the low risk patients that will be offered nurse-led clinic support with thyroid blood test remote monitoring. Able patients can then report their self-examination to their clinical nurse specialist as part of this initiative. Those that are unable or would prefer will continue to be examined by a healthcare professional. We aim today to show firstly how a professional would examine a patient and then easily translate this into a self-examination accordingly. The aim of self-examination is to determine at the earliest stage possible if a patient has a recurrence of their thyroid cancer, and it can be performed far more often than that of a healthcare professional due to limited access to hospital follow-up visits. Patients will then be able to request an urgent clinical follow-up as part of an open access scheme should they find any concerning signs. So let's start with the healthcare professional demonstration. So first, sit the patient on a chair. Sit in front of the patient and looking closely at both sides of the neck for any lumps or bumps. Check for any obvious asymmetry. Whilst inspecting the lower neck, ask the patient to swallow. A glass of water may be necessary at this point in time to aid swallow. Stand behind the patient and examine the back of the neck. Continue by placing your hand underneath the chin and using your fingertips, as these are the most sensitive part of your fingers, work your way along the jaw and up to the front of the ear and then behind the ear, and then palpate down the back of the neck. Place your hands under the ear and work along the long muscle that finally ends at the level of the sternum. When you reach the thyroid scar, ask the patient to swallow again and feel for any lumps or bumps that pass below the fingertips. Work your hands along the collarbone, nearly to the shoulder, and finally feel the space behind the long muscle above the muscle at the back. The aim of the self-examination is to emulate this examination as best as possible. Therefore, sit or stand in front of a large mirror where you can easily see your reflection to include your upper chest too. Look for any obvious lumps or bumps and any asymmetry, and swallow with water if necessary to see if any of the lumps become more obvious. Next, place your fingertips under either side of your chin and follow the previous steps demonstrated along the jaw, up to the front of the ear, behind the ear, and the back of the neck. Then starting from under the ear, follow the long muscle down to the sternum until you reach your thyroid scar. Feel your thyroid scar both sides while swallowing. Finally, crossing your hands, feel along the collarbone on the opposite side to the shoulder and then behind the neck again. Remembering to repeat both sides as necessary. Finally, remember to report any concerning lumps or bumps immediately to your clinical nurse specialist. Thank you for your attention.